Dr. John Swetech here at Swetech Medical Center. This is our basic talk on diabetes, what it is, and the things you need to be aware of. Welcome to our station. We'll start putting videos up at a regular basis. If they're a hit, we'll keep rolling. So what is diabetes? There's two main types of diabetes mellitus. Type 1 is usually when they believe that the body attacks its own pancreas and destroys the beta cells that give off insulin. This generally shows up in younger people. There are a lot of similarities to type 2 diabetes, which is basically what we're talking about today, but there are some big differences as well. Type 2 diabetes is a disease of insulin resistance, where the body does make insulin, but it doesn't respond appropriately in storing sugars. So we'll hit a few big topics. I'll keep it brief, and maybe we'll make a more in-depth one later, but with diabetes, sugar runs high. You use sugar for energy. However, we find that if it goes above a certain amount, you end up getting very hungry, very thirsty, peeing a lot. You can get visual changes. Those are the early symptoms. Sometimes people will start to go hypoglycemic too. They get cold sweats. They can sometimes even pass out. Usually weight loss unexplained can also be, there's many causes of that, but sometimes that can point towards diabetes. Basically, normal sugar should range from 70 to 130, give or take, in the average person. Our goal in type 2 diabetics is to keep this usually between 70 and 150, as long as we're not getting side effects. When the sugar is high, it tends to cause damage in the small vessels in the body, these being the kidneys, also feet, and also damages the vessels in the heart. So our main goal is to keep our blood sugar in that range, and we have to test for complications. I didn't mention eyes also. The retina has small vessels in the back. So the big things that should be done on a regular basis in people with diabetes are annual eye exams. You should get foot exams. You should probably check your feet every day on your own, but at a physician's office every year or so, sometimes every 6 months. Regular EKGs and watching how the heart's functioning and monitoring lipids too is important. And we should monitor the kidneys, make sure they're not spilling out any proteins. This disease can usually be controlled fairly well. A lot of times when people don't have it controlled, it's a compliance issue, and there can be many reasons for that. So we try to optimize our treatment as best we can for every patient. A lot of people these days can control their sugars with oral medications. That's the goal for everyone. There are some injectables that aren't insulin, and they do work really well. And then insulin is usually, if we can get it under control with the other meds. It does get a little tricky because insurance coverage is different from person to person, and sometimes all the therapies aren't available, but we try our best to figure out a good plan. The big thing too, we gotta keep it under control, because when your sugars are high, you don't have energy, you have an impaired immune system, you have a much higher risk of heart attacks and strokes. There's a lot of bad problems that go along with it, and it's important to recognize this illness and treat it accordingly. They don't have a cure yet for type 1 or type 2. However, they are working on some new treatments with, I think they have an implantable pancreas, they call it, that may be promising. That's more for the, I've seen it used in both type 1 and type 2. Type 1 patients generally, the best thing to do is get an insulin pump if you can tolerate it. There's also some studies being done on gut flora. I actually have a patient that is in a study, and they're working on this stuff. Hopefully they have a cure for type 1 diabetes soon. She's keeping me posted, and it sounds like they might be close. So yeah, Get in if you have diabetes or think you do. Our number is 586-228-0400. That's Swetech Medical Center. Our website is drswetech.com. Thank you. Have a good day.